The House Select Subcommittee on the Coronavirus Pandemic had a roundtable meeting on Tuesday. Here's some of what they had to say.
The greatest perpetrator of misinformation during the pandemic has been the United States government. Misinformation that COVID was spread through surface transmission, that vaccinated immunity was far greater than natural immunity, that masks were effective. Now we have the definitive Cochrane review. What do you do with that review? Cochrane is the most authoritative evidence body in all of medicine and has been for decades. Do you just ignore it, not talk about it? That myocarditis was more common after the infection than the vaccine. Not true. It's 4 to 28 times more common after the vaccine. That young people benefit from a booster. Misinformation. Our two top experts on vaccines quit the FDA in protest over this particular issue, pushing boosters in young, healthy people. The data was never there. That's why the CDC never disclosed hospitalization rates among boosted Americans under age 50. The vaccine mandates would increase vaccination rates. The George Mason University study shows it didn't. It did one thing. It created never-vaxxers who are now not getting the childhood vaccines they need to get. Over and over again, we've seen something that goes far beyond using your best judgment with the information at hand. We've seen something which is unforgivable, and that is the weaponization of medical research itself. The CDC putting out their own shoddy studies, like their own study on natural immunity, looking at one state for 2 months, when they had data for years on all 50 states. Why did they only report that one sliver of data? Why did they salami slice the giant database? Because it gave them the result they wanted. Same with masking study. Well, the data has now caught up in giant systematic reviews. Public health officials were intellectually dishonest. They lied to the American people. Thank you.
This next part, they were talking about infection, acquired immunity. This is wild.
In essence, we vaccinate people in order to develop immunity. So very early on in the pandemic, certainly by the time the Delta variant came along, we already knew at that point in time that infection-acquired immunity, if we had looked at real-world evidence, which we in the Doctors Caucus and we on members of this committee asked the FDA and CDC to look at, we would have acknowledged that there was infection-acquired immunity. It was valid, but yet our message to the public was that you're mandated to get a vaccine. And I think as you've alluded, this eroded trust in our public health communities. And I can tell you as a former director of public health who has good relationships with all of my county public health directors, they felt that this was a misstep by the CDC and a misstep by the FDA. So can you expand a little bit on infection-acquired immunity, the validity of it in SARS-CoV-2, and then whether or not we should be acknowledging that in children, placing SARS-CoV-2 or COVID vaccines on the recommended list for vaccines will, I think, hurt most of our low-income, impoverished children, our Head Start programs, as Dr. Joyce had mentioned.
Look at this part and listen carefully.
Yeah, by forcing children to have a vaccine that they don't need because they've already had the disease, that undermines the trust in other vaccines like the measles vaccines or the polio vaccine, and that's very, very serious. I think during the last several decades, we have the never vaccinate people or the anti-vaccine people have tried to undermine the trust in vaccine, but with very little success. But the vaccine fanatics who wants to vaccinate every person in this country, even though they are children who has very little risk for it, even though they have already had the COVID, that has undermined the trust in other vaccines enormously, creating enormous vaccine hesitancy.
So not allowing their provider or physician to determine the risk and the benefit.
Yeah, and also people themselves, because people know that about immunity. We learned that in school. People know that if you've had a disease, you had...
It wasn't until I came to Congress that I found out infection-acquired immunity was a novel concept.
Did you hear what she said, talking about natural immunity being a new concept? These guys next are great. These scientists and doctors school her and said, yeah, we've known about this since 430 BC.
Yeah, I guess we knew about it since 430 BC of the Athenian plague until 2020, and then we didn't know about it for 3 years, and now we know about it again. So
We have a little bit more time. Do any of our other witnesses want to comment?
Either she's a snake or she's brilliant.
I mean, I want to echo what Dr. Kulov said and the seriousness of this. The putting the vaccine on the childhood schedule, this vaccine where there's deep distrust, essentially sends a signal to the American public that these are equivalent to the polio vaccine, the measles vaccine, the DPT vaccine, all of which are absolutely essential for the health of children. Putting this on the childhood schedule decreases the uptake of those, then we will look back on this as a seminal mistake in American public health.
Thank you so much. I yield back.
Thank you. No closing remarks.
Oh, there's a lot more remarks, and I'll put the link in the description box below for the actual video. But guys, keep your eyes on this zero draft of the World Health Organization CA+. It's still going on today, Thursday, and tomorrow, Friday. And we should be talking about this maybe next on the video, because a lot of things are going on that we probably need to be discussing. All right, guys, let me know in the comments below what you think. Thanks for watching. We'll talk to you soon.